Okay. My name is Dr. Phyllis Hendry. I'd like to tell you about my research from the University of Florida College of Medicine in Jacksonville. We looked at the incidence and elevation and recognition of triage blood pressures in pediatric emergency department patients. Elevated blood pressure in adult patients is very commonly known about. Hypertension is a common disease in adults, but not in children. However, that is increasing, partially due to the increased obesity in children. Children often have elevated blood pressures in the emergency department because they're crying, they're anxious, they're scared, it's not their normal environment. We found a significant increase in elevated blood pressures at triage, far greater than we expected. In children over 1 year of age, 20% of them had a blood pressure that was greater than the 99th percentile plus 5 millimeters of mercury. So what does this mean? One, we need to train physicians in recognizing elevations in pediatric blood pressure. There are very complicated tables that look at this. It's not as simple as an adult knowing that you're looking for a diastolic pressure over 80 or 90. We also found that physicians did not recognize this elevation blood pressure. So this is a problem, and we could have been sending home a child with an elevated blood pressure. One possibility is that our tables that we use for blood pressure in children were developed almost 20, 30 years ago. They were using manual blood pressure cuffs. Now we use automated machines. So this brings up many interesting questions for the future in looking at elevated blood pressure in children. We hope to continue studying this and better educate physicians in recognizing elevated blood pressures in children in an emergency department setting.